Well, it is now noon. I'd like to say good afternoon. My name is Priya Mann. I'm a reporter and anchor at Local 4 in Detroit, and I'm honored to lead this discussion about the mental health and care of LGBTQ plus foster kids. This is a really important topic. I'm really looking forward to the amazing panelists that we have gathered and the discussion that we'll have. I hope that you guys get as much out of it as I will as well. Before we do get into it, I want to remind you that Samaritas values your time and your thoughts. So please feel free to submit a question or comment to any of the panelists using Zoom. To click on the Q&A button, you'll see that on your screen to submit your questions, and then they will be sent to me. I will read them out loud, and then any of the panelists, or if you have them for a specific panelist, they'll be able to answer your questions. So we do have a great panel of foster care experts to shed some light on the diversity within the foster care system. So let me tell you about all of them. And if you just want to wave when I mention your name, that would be great. I will start with Director Demetrius Starling, who is the Senior Deputy Director of MDHHS's Children's Services Administration, where he oversees the state's child welfare system, including Children's Protective Services, known as CPS, the foster care system, adoption services, family preservation services, and juvenile justice programs. It's so great to have you here, Director.
Thanks, Priya.
Up next, we have Jerry, who's Michigan's leading SOGIE consultant. He has 35 years of experience in designing programs to support and promote safety, permanency, and the well-being of LGBTQ plus foster care youth. Good to see you, Jerry.
Great to join you.
And then we have Kevin Van Den Bosch, who is the Chief Operations Officer at Samaritas, overseeing all programming, including foster care, independent living, and family preservation services, as well as refugee services and mental health and addiction services. Kevin has worked in the child welfare system in Michigan for 35 years and serves as the president-elect for the Michigan Federation for Children and Families. Thank you for joining our panel, Kevin.
Thanks for having us.
Now, we know from research that foster kids who are 8 years old and older have a really hard time finding a foster family to take them in. And if the foster child also identifies as LGBTQ+, they'll have a greater chance of giving up and striking out on their own, where they're often exploited. And we know that one out of every 3 children and youth in foster care ages 6 to 20 identify as LGBTQ+ in Michigan. So that translates into over 1,700 children in foster care across the state who identify as LGBTQ+. Compassionate and patient foster parents are essential to help these kids flourish. And research shows that there aren't enough licensed foster parents for older foster kids in Michigan. Plus, from conversations with past foster kids, we know that teens who identify as LGBTQ+, foster teens who are placed with foster parents who struggle to understand them and affirm them can have a damaging effect on the child's self-esteem, and that can last a lifetime. It's why Samaritas and MDHHS has assembled this expert panel to discuss how we can better interact and support LGBTQ plus youth and hopefully attract others who want to guide foster kids like this. All right, so I'm going to start with the first question to Kevin. And let's set the stage by defining foster care. So Kevin, what is foster care and why is it needed?
Gladly. Well, first of all, thank you so much for hosting today, Priya. We, on behalf of Samaritas, we really appreciate the effort that you're taking to host this really important event. And I also want to thank Director Starling and Jerry Peterson, as well as our ASL interpreters and our audience for joining us today. So what is foster care? Foster care is really meant to be a temporary living situation for kids whose parents cannot take care of them and whose need for care has come to the attention of child welfare agency staff. So foster care is really a service provided by the state to promote safety and well-being for each child while working to restore permanency. So while the kids are in foster care, they might live with relatives, foster families, or even group facilities. We do know from research that kids thrive when they can safely live in an environment within their own families. However, when home environments are not safe for kids to live in, they may temporarily live in out-of-home placements known as foster care. Those foster care settings, such as living with relatives, is known as kinship care. When placement with family is not an option, children may live with non-relative caregivers. But we all have to remember that a key goal of foster care is reunification with family.
So important to keep in mind. I do want to ask Director Starling what your thoughts are on kind of what you heard Kevin just talk about, but also can you tell us about how SOGIE training has been implemented at the state level, and also how your department has rolled this out to foster care and family preservation staff around the state?
Absolutely. Again, I want to echo Kevin's sentiments in regards to how appreciative we are as a child welfare community to be in this space together, and also for you to lead this conversation, and for so many folks to carve out some time today to be with us. So, relative to what Kevin has stated already, the state continues to make improvements in our operations and our oversight of the foster care system. We all know that the number of youth in foster care continues to decline, which is a great thing, thanks in part to the intentional investments and development of our prevention programs on the front end of our systems. We all feel as if working upstream, providing prevention services, whether it be concrete or economic supports to our families, or other interventions to divert families away from our systems altogether, is truly the right way to go. Foster care, as Kevin stated, is intended to be a temporary intervention for families who need additional supports to address their ability to provide safe and stable care to children while the parents work to address barriers to reunification. And this can be in many forms. It can be a kinship care provider, which is a familiar-like setting, whether it be an aunt, uncle, grandparent, or a licensed foster parent that can step in and take those children in, while, again, the family, the parents, the biological family gets themselves in order. The state of Michigan, through this administration, continues to make improvements on how we do business, right? So, including our investments in supports for our LGBTQI children and families that we are really looking forward to highlighting today. Our Children's Services Administration has begun to offer and require a specialized training. It's an inclusive engagement training asking about sexual orientation, gender identity, and expression, otherwise known as SOGIE, for all of our CPS foster care staff, our foster home licensing staff, adoption case managers, and first line supervisors. It's not a heavy lift. It's a 4-hour training that includes some really imperative topics such as terminology used to describe sexual or attractional orientation, gender identity, and gender expression, background information on the prevalence of individuals with diverse SOGIE in the general population and within our child welfare system, which we're starting to see more and more of, outcomes for our youth with diverse SOGIE, especially relating to the youth safety, well-being, and permanency, which are all key federal indicators for our child welfare systems when it comes to engagement of our children and families. Examples of accepting and rejecting behaviors experienced by youth with diverse SOGIE and the effect of these behaviors on youth outcomes. Regional and statewide resources, which I know that Kevin and Jerry will probably talk about some more, for our diverse SOGIE families, and requirements and processes for collecting and recording SOGIE data for youth, our birth parents, caregivers, and adoptive parents. We all know that data best helps us make well-informed decisions going forward. For some child welfare community members and stakeholders, engaging and encountering SOGIE youth is really a new topic. So it's incumbent on us as leaders in this space to be able to collect the right data so we can come up with the right programs for our youth.
Thank you, Director. Jerry, I have a question for you. If you could expand on what Director Starling was talking about how many kids do you estimate are in foster care who identify as LGBTQ plus?
So what we know from national research, and there are 3 major studies that have been done in the last 3 years, all of which came up with the same results. I think one of the most relevant for our geography here in Michigan is a study that was done in Cuyahoga County, Ohio, which is Cleveland. So it's a Rust Belt community, demographically much more similar to Michigan. And they found the exact same results as have been found on the West Coast and the East Coast. And that is that 1 out of every 3 children in foster care, 32%, identify as LGBTQ. And the reality is that I'm really delighted with the leadership that MDHHS is showing in terms of the inclusive engagement treatment that Director Starling just mentioned, because this is a way that over time we are actually going to have the factual information to know exactly how many children identify as LGBTQ within the system. But in the meantime, what we can do is to apply that 32% to the children between the ages of 6 and 20 in Michigan who are in foster care. And that translates to about 1,700 children across the state. And a quick word about why I say 6 to 20, because starting with age 6 is often surprising to folks. And the reality is, with the SOGIE lens, sexual orientation, gender identity, and expression, we're talking about natural human development. So every human being, all of us have a sexual orientation, all of us have a gender identity, everybody has a sexual gender expression. And those develop within us as human beings at the same time. Gender identity emerges first. So by the age of 6, children know whether or not there's agreement within them on their gender identity matching their gender assigned at birth. By the age of 10 to 12, children begin to have their first crushes and understand who they're attracted to. So these identities emerge naturally at younger ages than we think sometimes. So that's the reason that we're inclusive down to age 6 when we talk about this.
I'm glad you clarified that. I think, yeah, a lot of people might be surprised at that, but when you kind of lay out the ages there, I think a lot of us can look back and think about our own lived experience. Thanks, Jerry. For Director Starling, so you have some staff who have lived experience in foster care and who also identify as LGBTQ plus. Can you tell us how you tap into that experience to improve the foster care experience for young people today?
Absolutely. Great question. So one of the things, one of the major talking points that I've had since being named the director with the Children's Services Administration is that our department doesn't have the right answers all the time. So, child welfare has been in existence for many, many decades. And so it's incumbent on us to really lean upon the folks who our systems have impacted the most. So we have multiple groups of folks, of young adults who are either in the foster care system or have transitioned out of the foster care system that are really giving us some really pertinent ideas and input on how to best inform practice. So to kind of go back in 2022, we formed what is called the My Family Ally Team, which is short for the Michigan Family Advancement and Leadership for our LGBTQI plus youth task force, which was formed to review our current policies and practices and develop recommendations to enhance service provision, address identified gaps, and determine how to best meet the needs of our LGBTQI caregivers and youth in care. We heard that time and time again. We wish that our foster parents or kinship care providers or folks who were asked or required to take us into their home really have that edification and support that was needed, to deal with some of our trauma to deal with what we have experienced in our lives. And the primary goal of the My Family Ally Task Force is making recommendations and taking actions to support the success of our LGBTQI caregivers in their efforts, in their desires to foster or adopt children from Michigan's child welfare system. Secondarily, the task force will also make recommendations and take actions that best support our youth and our child welfare systems. So that, on top of the fact that we're really trying to pour more time and resources into our preservation services, which you had mentioned earlier, Priya, in an initial question, we've received a lot of input from our families impacted by preservation services as well. So our My Family Together hybrid preservation program, is a model that is going to replace our current fragmented central office administrated family preservation service that really has this keen focus on, again, prevention services, preservation services, but also reunification services that highlight some of the needs for our LGBTQI youth, and having this two-gen service philosophy that encompasses a strong family voice with more equitable, more holistic services for our families.
All right,
Director
thank you.
Starling, I love that answer. Two things that really stand out there for me is talking about the DHHS staff, and you're looking to make your team as diverse as possible with real life experience. I know at Samaritas and other private organizations that you work with, we're also trying to do that with our board, because the board is the overall governing body. And if they also have walked a mile in the shoes of and have that life experience, it just makes decisions and that governance, I think, just so much more robust. And then your discussion about preservation, I think, is also so key, because you've been leading the charge with the state of Michigan to move to this preservation model to keep children in their homes if we can safely do that and wrap services around them. But this topic of serving and caring for and giving the best to our LGBTQ youth, whether they're in foster care or home and preservation services, the message is the same, that we have to reach out and individualize treatment plans to give them the very best that we can here in the state of Michigan, correct?
Spot on. Yeah, and also one of the more important pieces of that is to ensure that their ideas and their beliefs and their feelings are
Yes.
being lifted up. So we don't want either our staff who identify as LGBTQI or our youth to feel as if we are tokenizing their voices. We take their input and we try our best to utilize that in either practice or policy implementation or enhancements. And they're walking that journey with us step by step.
I love that. And I also love the back and forth. So please feel free if you hear something that you'd like to jump in on. I think that's what we like. We like to see that back and forth. So thank you, Kevin. And Kevin, I'll start with you on this question. So children aging out of foster care face some uphill battles, as we know. Can you tell the audience what some of those challenges are and how this training will help them as young adults?
I think Jerry led us to the point of some of those answers, Priya, earlier, but you're exactly right. I look at just the data coming from Samaritas and the number of kids that we serve in foster care, and then how many of those, what percentage of those kids actually age out of the system. And there never seems like there are enough services for them at that point. So one of the things that we tried very hard to do at Samaritas is give them the tools they need before they leave our care. What are some of those tools? Some of those tools are the skills of life skills of getting a job, how to rent an apartment. But some of them, for our youth who are LGBTQ, it is also creating this safe place. So using a model like the sanctuary model to create a safe place for our youth so that they can dive into some of the issues that they've had to deal with in the past, and then better equip them and develop the coping skills that they need as they go out on their own. It's a big lift at the age of 18 or 19 to step out of a structured environment like foster care and to then take that next step to go out on their own. So advocacy on policy, advocacy on funding for services beyond the age of 18, making decisions like Director Demetrius Starling just mentioned, using data and having that drive our decisions to focus on results, and also just listening to the youth themselves tell us, here are our needs today. And then we work with them on best practices to give them the skills, the coping skills, and the physical skills that they need as they leave care and become a productive member of society.
Hey, Kevin, I'd love to add to that also that as important as family preservation is, when it comes to LGBTQ youth in care, it's also really important for us to be looking at how do we have support services for reunification, hopefully prior to aging out, but even as a part of the process of aging out, because I was the executive director at Ruth Ellis Center for 9 years. Ruth Ellis Center is mission specific to LGBTQ youth experiencing homelessness. The vast majority of those young people were separated from their families, but I never met one young person at Ruth Ellis Center who was not really anxious to find a way to reconnect with their family. That those family ties and bonds, regardless of how they may have been treated, the trauma that they may have experienced with families, does not seem to dim the desire to reconnect. So, we know that as young people age out, having another adult who can be of some support to them. So I think it's important that as we build services for families to help preserve those families in the first place whenever possible, but certainly even at a later point to help reconnect families is an important part of our planning for the future.
Yeah, I can't disagree with you more on this one, Jerry. I think that sometimes we have to have the mindset of burning the candle at both ends, right? So as child welfare agency leaders, we're all responsible for promoting the healthy development and well-being of our children and young people who are in care. But to achieve that healthy development, our children and young people in foster care really need to be involved in this sense of normalcy and, developmentally appropriate extracurricular and social experiences. So as you talked about, making sure they have access to support groups or, folks who have been impacted by our systems is really truly important. That's why I believe that our lived expertise groups really are playing an instrumental role in the way that we transform our child welfare systems. And people may ask, well, normalcy, what does that mean? Well, normalcy refers to allowing young people in out-of-home care to really experience childhood and adolescence in a way that's similar to their peers who are not in foster care. You have to understand a lot of our kids, our LGBTQI youth, are still going to high schools and still going out in the community and trying to re-engage with the sense of being normal. So we have to include ways that they could participate in various social and cultural activities, such as after-school clubs, sports, community events, to make it as normal as a transition back into their community-like setting as possible. And a lot of that is continuously building supports and strengthening opportunities for our young people in foster care as they transition from these temporary foster home placements. They're going through a very uh, finite set of culturally responsive services and unique challenges that this population endures, but also again connecting our young people to what they're more familiar with is extremely important. So I really appreciate you bringing that up, Jerry, because I think that's a piece that we kind of forget in our venture to try to uplift prevention and preservation. Extremely important, but we also have to think about the back end of our system as well.
Anecdotally, just having served as a therapist early in my career in a residential setting, what both of you are saying is so true. I can probably count on my right hand how many kids out of the hundreds that I worked with did not want to return to family, no matter what they had experienced in the past. And that real life normalcy that you're talking about, Director Starling, I could do some powerful therapeutic interventions, at least in my mind, using evidence-based practice. But there is nothing like going to a football game or a volleyball game and seeing one of those youth on the team, teammates cheering, and some of the other youth from that center going and cheering as well. That was powerful, and just so powerful for the youth, all of them who are participating. You're so right.
I love to hear that. Jerry, this question is for you, and feel free to respond and answer after him. So what are some of the practical things foster parents and foster care workers can do to support and guide LGBTQ plus youth while they're in the foster system?
So I'm gonna kind of answer an implied question first, and that is the families in the first place who struggle to accept their children. Folks who struggle with this, often it has to do with personally held religious values and beliefs. I'm a big believer that everyone has the full right to their values and beliefs. And it is possible to hold those values and beliefs and create a safe place for LGBTQ children and youth. And the way to do that is to provide an open-ended questions and an open-ended invitation for a young person to tell you what they're experiencing. It's really, really challenging for the vast majority of people in our culture still to have a young person say that they identify as a gender other than the gender that's on their birth certificate. That's a big challenge. But if we can find a way in our hearts to allow children to tell the truth about what they are experiencing inside, whether we agree with or understand them or not, providing the opportunity for young people to share their truth, their lived experience about what's going on inside them. Ask them open-ended questions about, what is that like for you? You know, do you feel safe? Where are you struggling? You know, are there any ways that I could help you? Again, we can provide safety and well-being for children by providing an open space for them to be honest, whether or not we fully understand or agree with them. And so that's really what I encourage our staff broadly, both across state agencies as well as the private contracted agency staff and families, whether they're families of origin, resource families in foster care. It's being willing to set aside our judgments and allow a youth to tell the truth about what they're experiencing. It's so protective. It's so important.
And if I could just add this, you know, one of the things to Jerry's point about services and training that's extremely important for youth while they're in our system. I think it's important for us to lift up what I really have a lot of optimism for, which is called the Journey Ahead. So in partnership with the Ruth Ellis Center, Journey Ahead is a 6-week virtual support group for youth ages 13 to 21 with an either open prevention, CPS or Children Protective Services case, foster care case, adoption, or juvenile justice case, as well as those who were in foster care on or after their 13th birthday. And these, again, are all youth who identify as members of the LGBTQI community. And the focus of Journey Ahead is to really prepare our youth for independent living. I think that someone may have mentioned earlier about the alarming rates of youth who identify as LGBTQI and some of the challenges that they experience once they transition out of care. And a couple of those are built around homelessness, you know, this sense of, you know, still undealt with trauma. So again, with the focus of Journey Ahead, they are looking to prepare kids for independent living, building some of those social and emotional skills for our youth, coping mechanisms that comes through best informed adventure therapy, and program goals also include learning to build and maintain a positive sense of self, community with other LGBTQI young folks who they can connect with, whether it be virtually or in person. transition age skills for our youth. Again, anything from learning how to pay your own bills, or how do you go look for a job, or how do you build a resume, how do you look for a place to live, and also coping skills and stress reduction strategies for our youth, again, who have these really high level traumatic things that they're still trying to grapple with as they transition into adulthood. So I'm really optimistic. I think the administration is really optimistic about this particular service called Journey Ahead, and the great partnership and thought partners that we have with Ruth Ellis, and looking forward to seeing some great outcomes in the future.
Thank you. We do have some audience questions that I'd like to ask. This can be for any of the speakers who'd like to start us off. So building on what the speakers have said, what are some elements that counties and agencies should build into their systems to let SOGIE youth know it's okay to talk to someone and engage with services that really help them?
I think I'll get it started. I think that's a really critical and key question. It's really intriguing to me because there was research done by a group, Russell, Toomey, Ryan, and someone else, that they did research on youth who are LGBTQ and have a trusting person in their life that they can share their story with, versus LGBTQ youth who don't have that person in their life. And they found that the youth who have that person in their life, whether it's a loved one, family member, caretaker, they are 3 times less likely to be depressed than someone who does not have that person in their life. And we know that many of our LGBTQ youth go to great lengths to keep their identities a secret. And we can imagine why they do some of those things. So I think the question, starting with that data, that research, to me as a program person, is really critical. So one thing that I know we can do, and that Samaritas's foster care department and leaders really work on with the newer foster care staff, our families, is to incorporate the sanctuary model. Many in our field have heard about it, but basically the sanctuary model is a model to do the really difficult work of foster care for the children, for the families, for the workers, but to create that safe place to do that difficult work, because that difficult work then can be very, very rewarding. And I think it has to start with that. It has to start with creating that safe place. And then that trickles down and up to our boards, to our staff. When it comes to advocacy, there's another piece of research that talks about how much bullying can occur in a school setting. And being part of and an active part of your child's life, and working with school personnel to also ensure that those 6 or 7 hours that our youth are in school every day, that it's an environment that focuses on education and safety and celebrating every person, their differences, rather than it being an experience of horror that our youth are coming back home from. So those are a couple key pieces that we've tried to implement here at Samaritas.
Yeah, I think, Kevin, you hit on a couple of key points that I was going to hit on. So the only thing I would add to that, outside of that, is something that I referred to earlier, which is, as a child welfare system, we know fully well we don't have all the answers, but
Right.
it's important that we lean on the folks, again, who have been impacted by our systems, not to tokenize their voices, but to actually have them with an equal seat at the table, to hear from them about some of the challenges, some of the horrors that they may have experienced in foster care. Use those ideas and go out to other stakeholders in the community to really create this safe space to say, how can we uplift their ideas, whether it be legislative changes to statute, whether it be reaching out to administrators in our schools and hospitals who also engage with this particular group or demographic of youth, and say, how do we change the system for the better? We don't want to have this antiquated or outdated system where they don't feel encouraged, they don't feel embraced, they don't feel like they have a place in our society. So it's important to us as a group, as of child welfare professionals and stakeholders in the community, to come together and hear their voices and change practice and policy as we see fit.
I'm so glad you added that, Director Starling, because these are the youth that are our experts in this field, and we need to listen to them. And how empowering that is too, that your voice matters, and it practice what we preach. We say your voice and you matter and that you have value, but then we're showing it by doing exactly what you just said. So that's a great addition.
Do
I'd
you have
like
another
to,
audience? Go ahead, sorry.
if I could just add to that also, I just want to uplift again the inclusive engagement, asking about SOGIE training. The intent there is over the course of the next 2 to 3 years, as the training is offered, to really equip as many people as possible to feel comfortable asking children age 10 and up, and that's every child age 10 and up, about their SOGIE identity. It's not so, the more that children become accustomed to being asked about who they are, over time, we believe that they will gradually feel more and more safe to self-identify. Here at the beginning, unfortunately, if they've been traumatized for who they are as individuals, whether at school or in the community or at home, being in the uncertain environment of foster care is not necessarily the most likely place for them to self-identify. So it really is going to be incremental change, but it's critically important for folks to try to move beyond their fear of talking to kids about this topic, and to provide opportunities for them to be able to be honest and open about who they are and get support. So, the long-term gain of that training is a critical component of the response to this question.
We do have a question for the entire panel. So everything you're saying sounds great, but what is the state actually doing today to help teens who are feeling like they want to give up and just leave home? Where can they go?
So I think that this is it's a very important, but it's also a loaded question, because we right now are in the beginning phases for the most part of really trying to implement different strategies and trainings for our foster parents and our youth, but we do have lived expertise groups that we can activate young adults who have been in our system, who identify as LGBTQI, and we have a way or means that we can not only pay for their time and their services, but also activate them to be supports for these young adults who are experiencing trauma. Outside of that, one of the things I definitely want to highlight is the need for foster parents who can be, again, the tip of the spear for us when it comes to caring for individuals who are experiencing some of this trauma. This takes a lot of time and attention and patience and loving homes, and we need caring adults who are willing to provide that stability and safety for our children, our LGBTQI children who are in care. So these foster parents really should be committed individuals who are willing to work with not only the child's birth parents, but also the child, whether it be, you know, uh, therapy, whether it be classes that the youth wants to attend, support groups. They need to be extremely supportive of that youth and be patient with that youth coming out and expressing their sexuality. They need to be able to encourage the teen or the young adults towards independent living, and be able to be that support system as they, again, kind of grapple with some of the things that they may be internally working on. So outside of the foster parents who we can provide services and supports to insulate their home, we have a venue where we can have our young adults who are either in our systems or been transitioned out of our systems, a part of our lived expertise groups, that we can connect with these young adults who may be struggling.
And to the person who asked that question, thank you very much for that question, because it gives me a chance as a program leader to say that, I've known Director Starling now for just a few years, and so appreciate his leadership overall and in the area of DEI work. And he's a great leader with a very tender heart. And I think, I mean, some of the changes are going to be hard to, it's going to be hard to see some of them today at the grassroots level. But when we talk about the trainings that are going on, the number of changes and the emphasis on the DEI work, it's pretty amazing to me. One of those that I see as an administrator is just the attestation process that occurs. What's that? Well, we have so many contracts that we sign with the state of Michigan to do work with them. So today, typical contract language says that the bidder must agree not to discriminate on the basis of race, religion, color, sex, including gender identity, sexual orientation, et cetera, and provide attestation that this requirement is or will be met. So this is coming from Director Starling's office, and he's saying, if you're going to do work with Michigan kids, then I want to know and will hold you accountable that I have these expectations for you to care for kids in the best way possible. And our response at Samaritas is that we do attest that this requirement is being met, and we're doing all we can. We're not perfect, but we're doing all we can to value and respect the clients that we serve, and that we're trying to hire people that reflect our clients as well. And then my signature goes on there. And to me, that is my statement that you have my word, Director Starling, that this is what we as a private organization are working towards. So I appreciate that piece of the attestation process.
I do have a question for either Jerry or Kevin or both. What is your advice for foster parents with strong religious beliefs who are nervous or even uncomfortable about fostering an LGBTQ plus child?
I'm going to jump in there, Kevin. So the first thing I would say is all children need love. And for foster parents, if you are fostering teens, you already are loving children that you don't always understand or agree with, whose lived experience may be very, very different from yours. All children deserve and need a place where they can be nurtured, to feel safe, to have their basic needs met. And again, I would just say, if you can open your heart and see the person in front of you as a human being, the other element of that is absolute honesty. You know, unfortunately, a lot of folks with religious and values and beliefs that make it challenging to accept LGBTQ folks have experienced a lot of judgment and have been put down by others for their beliefs. And so there's real reticence. There's some real fear and reluctance to put themselves out there and to hold their beliefs and to let both of these things be true. And I think that's really unfortunate, because if you're a family who says, I love kids and I want to provide a safe place for them, and in conversation with children and youth, and particularly with youth, I would also advise families be honest. Say, you know what? I don't have much experience with this. I don't really understand this, but I'm willing to try. I'm willing to try to learn. I'm willing to hear you out and to support you in your life. I may not agree with you, but I am willing to support you trying to figure out who you are and how you want to live your life. That's really, it's possible to do that. And that's what I really encourage families to work toward.
And I really appreciate you asking that question. Many people have that question in the back of their minds, but because they're afraid of judgment, don't ask the question. So it's a wonderful question. And Jerry, what a wonderful answer. I think, Priya, the only thing I would add is one of the first things that attracted me to Samaritas was our mission statement. And that mission statement is simply this: serving people as an expression of the love of Christ. So what does that mean? When I read that the first time before starting my career here at Samaritas, I break that mission statement down into a few parts. First of all, serving. To me, that basically connotes washing the feet of, walking alongside of, or caring for. And then you have people. We don't say certain people at Samaritas or people who just think and act just like me. We say people. So serving people, that means everyone who comes to our door. And the tail end of that mission statement, as an expression of the love of Christ, I know as this is a person asking about being a foster parent, but as an employee, what we try to do, and I think this correlates to becoming a foster parent as well, is we strive to serve professionally and with unconditional love. Just as Jerry said, because it's a demonstration that each person has value. We strive to make a positive impact on each person's life. And it means taking action, expecting nothing in return. And bottom line, it means that every human being is treated with respect, and they deserve to be safe. So, Jerry, I love your answer. And I think Samaritas's mission statement can carry over into what it would mean to be a foster parent as well.
Thank you, Kevin, and thank you, Jerry. This question is for any panelist. We all know mentors are critical elements for all foster youth. What are some ways that adults can engage with foster youth apart from being a foster parent to help guide these young people as they enter adulthood? Are there like any formal programs?
I think that, Ruth Ellis, in my opinion, is and also in tandem with Samaritas. They are leading authorities or subject matter experts when it comes to how we engage and interact with this particular population. And one of the things I want to say that, first and foremost, before I answer this question, I just have to give kudos to Kevin and his team and their leadership as far as really kind of going out there and, kind of walking this fine line with us as a department. We all know that sometimes some of these quote unquote controversial topics don't land well with others, but the staunch leadership that has been demonstrated by Kevin and his folks and Jerry and his team and Ruth Ellis and all those folks has been nothing short of amazing as we walk this journey together. So I just want to say, first and foremost, thank you all for your leadership. Thank you for really standing firm in the cut with us because it means so much. So I say all that to say that, I would encourage folks to, directly reach out to the leaders at Ruth Ellis and Samaritas to have these discussions with them about how they can play an imperative role in the lives of these young adults. I think that with their expertise, their background, their institutional knowledge, they'll be able to either point you in the right direction in regards to how you can be a part of a support group or how you can potentially be a foster or adoptive parent in this space. If you're not ready to be a foster or adoptive parent, you want to serve in the capacity as a support, I would encourage you to reach out to Samaritas and or Ruth Ellis, because again, they're the lead authorities. They can provide you with the right edification, training, knowledge, and prepare you for that journey that you're going to set forth on.
I love that. This question is for Jerry. SOGIE training is a new thing for a lot of folks. Can you give us an example of how the conversations about sexual identity and gender expression differ when speaking to a 6-year-old versus a 16-year-old?
That's a really great question. So yes. So let's talk about sexual orientation. It's a little bit simpler. Director Starling mentioned earlier the language of sexual/attractional orientation, and that's part of the training and talking with children. The very first way that attraction shows up for kids, usually by around age 10. For some kids a little earlier, for some a little bit later, is their first crush. Who'd you have your first crush on? And essentially, what all the research and even our lived experience tells us is that whoever a child naturally is attracted to or has their first crush on, that is the first expression of their sexual orientation. So asking a child under the age of 10, we don't ask about sexual orientation. We don't ask about who are you sexually attracted to. It's not an age-appropriate question. That is appropriate above the age of 13, 14, because that's when children are either already, unfortunately, sexually active or much more aware of sexual activity. But under those ages, we're really talking about who you have a crush on, who are you attracted to. When it comes to gender, we really do not currently promote asking children under the age of 10 about their sexual orientation or their gender identity. But what is more likely to happen for a 6-year-old, for example, is that a child may actually say to you, and you know them as a child whose gender assigned at birth, the gender on their birth certificate is male, but they might say to you as a foster parent or someone on staff at an agency, you know, I'm not a boy, I'm a girl. And that's where I would suggest it is possible for a child at the age of 6 to have that sense that the gender identity that they feel on the inside doesn't match the gender on their birth certificate. So what we do in those cases is just to ask open-ended questions and just ask a child to say, well, can you tell me more about that? What does that feel like for you? Or what does that look like for you? And just allow the child to say whatever may be on their minds. It's not asking leading questions. It's not drawing any conclusions. It's just allowing a child to safely explore something that's going on inside of them in a way that does not shut them down or make them feel unsafe. So those are a couple of examples of ways to address those identities at those ages.
And I think what I hear you saying, Jerry, too, is you're really applying some of Erickson's developmental stages into your answer. Erik Erikson had 8 developmental stages. One of those stages, I think the question was about ages 6 to 16. And a child in that age range of around 6, Erikson called that initiative versus guilt. And that's a play stage. So you might see a child acting something out that they're thinking about or worried about or stressed about in some type of play therapy. That's where they're learning from mistakes and building some of that self-confidence. But as we get to the age of 16, Erikson calls that identity versus role confusion. And that's the stage, whether you like that term or not. I'm using something that Erikson said, but basically that's the stage in life where our children are maturing and becoming adults, and they're exploring who they are and how they fit into the world. And so I think one of the most powerful tools is the simple tool of just asking genuine questions at that stage when they're 16. If you don't know, it's okay. You don't have to be, a doctor doesn't have to have had cancer in order for him or her to operate on a patient. You don't have to have all the answers. Some of the best staff that I've ever hired are the staff that worry about, am I good at basketball? Can I teach the kids how to play basketball? Some of the best staff are horrible at basketball, but they say to the kids, you teach me how to do a layup. That's so powerful. So to empower the kids and ask questions at that stage, I think is really key. So Jerry, I like how you wove some of Erik Erikson's developmental theory into your answer as well.
Love that. That's great. Kevin, you talked about that sanctuary model. Can you give us some examples about how to create that safe space in a foster home or any home for that matter?
Yeah, these are just practical tools that we've used at Samaritas. But for instance, foster family recruitment. How do you make sure that your home is welcoming and affirming to all? Because we want our youth to feel safe. And we know the good news is that rejection, maltreatment, and other types of traumas can really be mitigated to some degree by foster families who acknowledge and respect the things that we're talking about today. So making sure that the school system is a safe, warm, and welcoming environment. Sanctuary model would say, create that safe place. So that's not a place for off-telling jokes. How painful those can be for someone who is in that stage of wondering or identifying this way, and others don't know that yet. So it's that authentic youth engagement that we've talked about. It's creating that safe place in every part of the home with friends coming over, whether that's the adult friends or the kids' friends, talking to family members before Thanksgiving. It's any of those type of those small steps that can make a giant impact. There's a book that Dobson wrote called Killing Giants and Pulling Thorns. The giants are those big things in your life that everybody can see. A broken bone, you can see it, you have a cast on. But I think some of these things that we're talking about can be those thorns. You don't see 1 or 2 or 3 or 4 thorns in my shoe, but I'll tell you what, if I'm going on a 4-mile hike, those thorns will have a major impact on the joy and pleasure I get out of my hike. So we at Samaritas, working with Director Starling and DHHS, we want to address those giants, but also those thorns, those unseen things, those little messages that get conveyed that just prick at and hurt just as much.
I have a question for any of the panelists. What can a foster parent do if they suspect their child is struggling with their gender and sexual identity? Are there any classes that could help?
So I am offering training to resource families to kind of set a base and groundwork for being able to really explore their willingness and ability to support LGBTQ kids in their home. Also have launched a monthly resource family gathering to come together where I'm sending out resources to about 70 families who have identified their openness to parenting LGBTQ youth. Monthly, I send out an email that includes some online resources, a training, maybe a video, and then provide a 1-hour gathering once a month on the last Tuesday of every month. We're gathering just last night, and just have discussion together because as Director Starling has said, I'm not the expert on all things SOGIE. Families learn a lot from each other and can really understand what it means to support a child, whether or not they fully understand or agree with them. So those are a couple of things that I'm offering in my role as a consultant with MDHHS.
Certainly important resources there. Thank you, Jerry. This is an audience question, and it's probably for Director Starling. How can Oakland AD partner to aid in the process of guiding and coaching those aging out of foster care with career and academic goals?
Absolutely. So I did respond and asked that person to contact me. I think it's so important for us to really lift up the whole idea or concept in regards to building supports and strengthening our opportunities for our young adults. So we all know for young people in foster care, especially those transitioning out of care without permanent connections and our LGBTQI youth, it's extremely important for us to provide some services as soon as possible. And that could be either through state-funded or federally funded services or programs that kind of help bridge that gap between stability and instability. And also support should be culturally responsive and in tune with the unique challenges that our youth are up against when they identify themselves as LGBTQI. So again, this is either from the front end part or process when they enter into our systems, when they experience foster care altogether, or when they exit our foster care system. It's extremely important for us to connect our young adults to services, grants, events, opportunities in this very critical way to support them in their transition or in their transition to being young adults. So I encourage that individual to reach directly out to me so we can have some discussion about how we can best partner as a child welfare community.
I love that. Just answering them directly. That's great, Director Starling. Jerry, you mentioned earlier about kids as young as 6 who need some guidance and understanding. Can you talk a little bit about how the training helps structure age-appropriate conversations? I know you had talked earlier about what you may say to a 6-year-old isn't what you would say to a 13, 14, 15-year-old, but could you help give us a sense of what the structure of a conversation like that would be?
So this is where the training, it's a 4-hour training. So while it's not all day, it really is extensive. But just as an abbreviation, number one, it really is about staff gaining comfort in asking all children just about how they identify. So there are suggested scripts that are provided in the training, which are really important to support people in asking these questions, and they are specific age-appropriate scripts. And we are putting together some guidance that will further distribute these scripts and make them available to private agency staff and to folks who've not necessarily taken the training. I know I'm not getting really specific here, where the question is pretty specific, but it's a little challenging to do in this particular context. So I'm going to pause there.
It's good to know that there's resources available for folks who may want to expand on that. It's hard to take a 4-hour lesson and condense it into a 2 or 3 minute answer, but we appreciate the effort.
It's kind of complicated.
For Director Starling, we know more foster parents are needed. What advice would you give to people who are thinking of becoming a foster parent, but may be hesitant to take in a young person who identifies as LGBTQ+?
Oh, I love that question. Thank you. My department and I, we really cherish the opportunity to talk about the importance of being foster parents, especially for this particular demographic. And I want to start off with a quote from an educator and children's advocate, Rita Peterson, who stated, "Every child deserves a champion, an adult who will never give up on them, who understands the power of connection, and really insists that they become the best they can possibly be." We really wholeheartedly believe that every child, every Michigan child deserves a champion. And, we've talked about numbers previously. In Michigan, currently there are around 10,000 children in foster care, but there are not enough foster homes, especially for teens, sibling groups, and our youth who identify as LGBTQI. As a foster parent, you can be that champion, that loving, positive influence on a child. Foster care really keeps our children safe when they cannot return to their family right away due to any safety concerns that came up as a result of the Children Protective Services investigation. And if you have ever thought about becoming a foster parent, we really want to encourage everyone on this group that's an earshot of myself to either think about it or go back to your respective communities, family members, and friends and talk about the importance of being a foster parent and that critical role that you could play for our children who need loving homes. MDHHS is looking for and will continue to look for compassionate individuals to become foster parents for our LGBTQI youth. You could really become a part of a very special community and group of people who provides this safe, stable environment that's cultivating for our youth and that really highlights the needs for reunification with their families and or their communities. as a foster parent, you will have all the support that you need. So from the start of the conversation or the reach out that you may have to our department, we'll link you up with a network of local resources, including community and faith-based partners, if you would like that, to Jerry's point and to Kevin's point earlier, ensuring that you have all the services and supports that you need to be successful. And when folks are ready to learn more, I would just encourage them to, reach out to either 855 MICHKIDS, it's 855 Mich Kids, or they can visit our website at michigan.gov/hope for a home. That's michigan.gov/hope for a home.
I love that. Thank you, Director. We've been talking about some tools, right, for families and for parents, but what tools are available for parents who are fostering closeted kids? What should they do?
Jerry, you want to take that one?
Yeah, I'll dive into that because unfortunately, that may even be more common. If we think about 1 in 3 children identifying as LGBTQ, and yet for families who may have been fostering for years, if you ask them how many children have you parented who actually came out and I self-identified, it may be a very, very small percentage of those. And so what's really important is to monitor how you talk about LGBTQ people. If you recognize that there are conversations going on in your home that are really negative toward LGBT people, you might potentially really be harming a child and have no idea that you're doing it. And I wouldn't just call out LGBT folks. I think any kind of dialogue that we have in our homes that are judging or putting down other people based on who they are, regardless of what that identity may be, is something that we really want to guard against in foster care. And so just being aware of our own language, our own messages, that's one that's really important. Another one that's really important for kids, particularly teenagers when they start to date, there's a real tendency to always want to say, well, who are you dating? That boy or girl, someone always of the opposite gender. But you can take the gender out of it and just say, hey, is there somebody at school you're attracted to or that you're really interested in? You can take the gender out of those conversations or the orientation out and just provide an open opportunity for people to tell the truth about what they're experiencing in their lives. Those are a couple of key ways just to provide safety when you have no idea how a child in your care may identify.
School and community groups do to help this group of kids?
For schools, I really encourage Gender and Sexuality Alliance formation. Now that can be challenging in some public education settings these days, but private groups where young people can come and meet with each other and explore their identity in a safe space while they're at school, I think is a really helpful thing. Across Michigan, there are over 100 GSA groups in high schools, some even in middle schools. People could reach out to me after this session. You will receive my email, contact information as a follow-up. Feel free to reach out to me. I can provide information about various support groups and services and GSAs that are available for LGBT kids.
And we can also provide resources for those families, schools, and send those out to folks. There are so many organizations as well as DHHS that provide resources. I know, like at Samaritas, we have a resource library for all of our staff to be able to go to or to talk in a team meeting. One book that I just recently read just in preparation for this meeting, and because the topic is so critical to me, someone from Samaritas told me to read the book by McCormick, LGBTQ Youth in Foster Care, Empowering Approaches for an Inclusive System of Care. Easy read, 3 hours. I could see a principal of his or her school having the teachers read that book and then go over questions and talk to see once how they're going to address certain topics. What can we do to be creative about bathrooms? How do we want to make sure we're an anti-bullying school? The book simply focuses on real kids and their real stories, permanency challenges, trauma-influenced care, and it gives data. And it focuses again on the things that we've been talking about today: safe, affirming, and accepting care. And so I think even a simple task like that can draw a team of teachers together and find out what their similarities are, what their differences are, and make sure in the end that every student at that school is treated with the respect and dignity that they deserve.
And also, I would just add that, as I stated earlier, folks like Jerry and Kevin are the subject matter experts and leading authorities in these areas. But as the scope starts to get much larger in regards to finding connections in the community, that folks want to really provide their ideas, input, or an innovation around how we engage our LGBTQI folks. I also encourage folks to look at some websites also that are really providing a lot of good information. There's one that's called the LGBT National Help Center. And within that website, you can find local resources that are near you. So it helps with finding connections about, the overall LGBTQI community and how they can offer community resources, ideas on how to engage with doctors, lawyers, social groups, child welfare professionals, youth support programs, children, or excuse me, school administrators. And it's a really simple website, really easy to follow. You just go in, you put in your zip code, you put in the category and hit the search button, and it'll spit out a bunch of different resources or people that, either foster parents or biological parents can connect to in their respective communities. So again, I just encourage people to go to that LGBT National Help Center website.
You, Director Starling. This question is for Kevin. Samaritas has always welcomed all foster parents, regardless of sexual orientation or gender expression. Are there any other foster care myths that sometimes stand in the way of someone who wants to be a foster parent, but might think that they're not qualified?
The answer is yes. There are all kinds of myths out there. And in this regard, I hardly consider myself a subject matter expert, but when you stop and think about it, one of the things that really intrigued me, Priya, when I came to Samaritas is that Samaritas not only does domestic foster care, but we also work with refugee youth. And so it wasn't that long ago that Samaritas bid on long-term foster care for refugee youth and put our focus on LGBTQ youth. And when we looked at the data, we decided we want to be a gap filler in that particular area. We're experts in foster care, we're experts in refugee services. So combining those two areas helped us be able to step in and fill a need. Here's what we found. Youth entering foster care, domestic foster care, or refugee, they arrive with many of the same feelings. There's feelings of loneliness, anxiety, confusion, fear. Everyone that I've talked to has some degree of feelings of vulnerability and have experienced some level of trauma. A youth and refugee foster care at Samaritas may be separated from their family by 4,000 miles. Well, a youth in Michigan may be separated from their family by 20 miles. but they've both experienced separation. So the myth even that there's this big difference between refugee and domestic, we see differences. We see differences in culture, such as the type of foods that kids eat or religious practices. But based on the research, we know that the feelings of separation, abandonment, rejection are still strongly associated with that depression or suicidal risk for our kids. So I can't do it as a foster parent. If you're on today listening and have an open heart and an open mind, you can do it. It doesn't take some superhuman skill. It takes a love for kids and then so much more, because just that isn't enough. Our kids are complex. They're very complex. So if you're willing to work with a private agency, with DHHS, and explore and learn more about yourself, I can imagine how rewarding it will be for a family to accept another person into their life, into their family, sitting at the table next to them. But this concept of not us, someone else, it's always easy to pass the buck. But if you can step up, think about the ripple effect it can make on others in your churches, in your schools. When they see that you've been able to open your home for someone, they may consider doing the same thing as well. So for me, that biggest concept is just not me, or I can't do it. I don't have the skills to do it. We believe you do. And if you're willing to work with us or another private organization, you can be very successful as a foster family.
You may have answered this, all of our panelists, at one point or another, but I'd like to know what happens to the kids who get too old for foster care. How's it different for LGBTQ plus kids?
So there are various stages, as we talked about at the beginning. There are independent living programs where kids can live on their own with some support from the state through private organizations. They can live in a group home. Even at Samaritas, for our refugee youth, we have a post-18 home for kids 18 to 21. Kids that are not, they feel like they're not quite ready to move out on their own, but they still get some level of support from Samaritas to assist them. I recognize that there's more that could be done, and there are more robust services that we can provide. But whether a youth, comes to us who is LGBTQ or not, those service lines do exist. I think that the risk level goes up with our LGBTQ youth based on the research and data that we have. And so working hard in conjunction with DHHS, finding someone, as Director Starling mentioned earlier, finding that champion in their life is so critical to the success later on. Again, imagine going out on your own at the age of 18. It's a scary world, and that can feel very overwhelming, let alone having some of the feelings of vulnerability or safety as a youth who's LGBTQ.
Yeah, again, to Kevin's point, we have a host of living arrangements and services for older youth because the support doesn't stop when they turn 18 or when they turn 21. I think that, not just for LGBTQI youth, but any youth at that particular age, and even folks on this call, I'm pretty sure I can say strongly that, when you're 18 or 21, you're not ready for the real world, right? I certainly wasn't. Heck, I don't think I was ready for the real world until I was about 30. But we have supportive, independent skill development services. We have living arrangements for all of our youth 14 and older, and youth 16 and older have a variety of potential living arrangements, including unrelated foster homes, licensed or unlicensed relative homes, staff who are supporting our independent living programs, and also just opportunities for teen support or even adult support programs anywhere from pregnant or parenting youth on to LGBTQI youth who need that further support and development as they transition into adulthood. And, these are not cookie cutter services. These are services that are retrofit to the needs of that particular youth. So again, if you have a youth who identifies as LGBTQI, we'll be able to, direct that youth to the right services, independent living program, and also support program to support them into their adult transition.
Director Starling, I still don't think I'm ready for the real world. So whenever that happens, I will let you know.
Please do.
We are starting to near the end of our time. If there's anyone watching who does have a question, please get it in quickly and we will try to get this in. But as we start to wrap things up, I'd love to hear some closing ideas or thoughts. First of all, what your thoughts were on the discussion that we had today, and also looking to the future, what can we do to improve? What are our goals? How would we like to improve the quality of the lives of our foster children, and especially those who identify as LGBTQ+.
If I could start,
I knew
yeah,
that was going to happen.
okay. I just want to say, again, when a child is identifying or coming out as LGBTQI, I think the most important thing for them to know was that they have support, whether it be from a familial-like setting or someone in the community who loves and supports them. And as a parent, there are some folks who might worry about whether they will be accepted, and that's a genuine concern, right? But I think it's more important to stay positive around your youth and make sure they know that they can count on you in their time of need. So if you're having a hard time accepting your child coming out, talking to a support group can certainly help. You can find one for our parents or of LGBTQI young or youth through an organization such as Ruth Ellis or Samaritas. I think again, it's so important to recognize and acknowledge the folks who are really in the work. They're doing the work, boots on the ground, so they know exactly what the challenges are for our systems. And reaching out to those folks is extremely important. You may want to talk to a therapist or someone in a faith group or someone in your community that a youth is comfortable with or has a connection with. Dealing with One thing is dealing with your own feelings, but also finding a way to help support your youth in this really sometimes confusing time in their life is extremely important. And if you're worried about your child's safety, I think that opening up a conversation with your child when they're ready is extremely important. And also really lifting up the fact that you're an advocate for them, that you're a champion for them in this time, because they really need that in a world that sometimes they're kind of confused or having a hard time, whether it be at school or with their friends, and having someone that they can count on to make that big difference in their life is extremely important. Most young children, come out to their friends first. So don't take it personally if you're not the first one that they tell, because they really, but in a lot of instances, they will go to someone that is in their same peer group or someone that they can identify with a little bit more on that particular subject. Some teens are just afraid to talk to their parents because they may fear withdrawal, or they may feel fear of being kicked out or being pushed away. When it comes to telling other family members, let the child take the lead. Don't push them into a discussion that they're not ready for. They might know exactly what they want to do about it. They may not actually have all the right answers. So let them lead that discussion. The most important thing is to respect what they want to do and keep that conversation open, and also seek out any guidance or support that's needed, either from a kinship care perspective, foster parent perspective, or biological perspective in your respective community. There's a lot of information out there. Google is your friend. Believe me, if all you have to do is type it in, and they will definitely spit out different opportunities or resources in your respective community to help with these conversations.
The thing I'd really like to uplift is something that I said earlier. I would really love to see one of the best next steps for MDHHS and for private agencies is to find ways to fund family intervention models for preservation and reunification to really support LGBTQ kids being able to stay connected, even if it's kinship care, maybe it's not their original, biological nuclear family, but kinship care, just to stay connected with people who they have known and loved. The federal government has done some research studies, and there is an emerging program that is really, really promising in terms of doing that work. And so I am really hopeful that that's something that we can build and incorporate on all the great steps that have already been taken by CSA over the last couple of years.
And if you happen to be one of the kids that we've been talking about today, I know that Director Starling and Jerry and Priya, we want you to have the message that we don't want you to be alone. Life is a journey. And if you're listening today and part of the audience, I'm so glad that you joined. But maybe there are different feelings going on, the feeling of loneliness or feeling scared. To Director Starling's point, reach out to a friend, a parent, someone at church, someone you feel safe with. Contact Jerry, contact Samaritas, contact Director Starling. We don't want you to do this journey alone, and we will walk alongside you, judgment-free, and be part of that journey with you. If you have questions about Samaritas in particular, our treatment philosophy, our mission statement, even questions about being a foster parent, please also reach out. But I think about the potential of kids being on here today. School's out for a lot of people. And so I wanted to just share that as well, Priya, because we may be in a sport coat and in an administrative position, but we're still in this field because we care about kids, each kid. And if that's you today, reach out. Please reach out to us.
Yeah, that is so important. I think that we've heard great insight today, great conversation back and forth, a meeting of the minds on some really good ideas as we look to how we can help kids today and moving forward. I do want to remind everybody who is in the audience that links to all of the resources that were discussed today will be up on the website pretty soon. So there will be a way to access some of the resources that we discussed today. I want to thank you for joining us, and I hope you found this hour informative and reassuring. And I would also like to offer a particular word of thanks to our panelists, to Kevin, to Jerry, to Director Starling. Thank you so much for taking the time to talk with us and share some of these ideas. More information about foster care topics will be emailed to you later today, but please feel free to check out Samaritas at samaritas.org/foster care month in the meantime. Thank you so much again, and I hope you all have a wonderful day.
Thank you. Take care.
Thanks.